So how about that aging population patient, the one who's aged 80 or better? Many people come into my practice and ask me, at over 70, should I really be doing this? I mean, is the implant really going to last? Is this a wise idea? And, I don't have a lot of time left on this earth, Dr. Rosen. How long am I really going to need to wait? They don't want to wait because they don't think they have the time left. The problem is you juxtapose that with a famous saying by a famous basketball coach in the United States named John Wooden. And John Wooden best put it, if you haven't got the time to do it right, how will you have the time to do it over? So you have these two forces tugging at you. One, the patient has a rush to get done, but two, you want to proceed with caution. So here's a patient who comes into you. She's 85 years of age, low lip line. She has a lateral incisor that's going to be lost. And the question is, she has a non-contributory medical history. Her concern is decay that's dooming this tooth. And the confounding factor that I have is that this patient under no circumstance wants any radiographs exposed during the process, as few as is humanly possible. And oh yeah, by the way, she doesn't want to wear a transitional partial denture, and she doesn't want to be edentulous. So what am I going to do? So the tooth is extracted atraumatically. That's what we always say as surgeons. Everything's atraumatic. The difference between atraumatic and traumatic is if you're the patient, it was traumatic. If you're the surgeon, it's always atraumatic. So I removed the tooth atraumatically. I placed a dental implant immediately, and I observed the insertion torque to be 26 Newton centimeters, but the ISQ is 78. 78 buccal palatally, 78 mesiodistally. And the question is, what do? Do you put a healing abutment on? Do you provisionalize? Do you bury the implant? Well, this patient wants to go forward with provisionalization. Normally, 26, I'd be on the fence, but with a 78 ISQ, I felt very comfortable because this patient, I feel, is compliant. She's been in my practice for 30 years. I know that she will listen to directions. So the decision was made to provisionalize her. And this is how it looked on the day of placement. Fortunately, she was willing to let me expose this one radiograph. So in the subsequent healing, what I was going to do was to use the Osstell machine. And this is how she looked on the day of placement. And at 4 months, you can see plaque control is not ideal with this patient. We repeated the ISQ values. And you can see, yes, we've had a drop from initial, but this has been very, very stable overall. She has very high stability readings at 16 weeks, and I feel that at this point at 4 months that we can go forward and complete her. The problem I find many times with patients is that with these second and third generation implants, bone healing proceeds quicker than soft tissue healing. And this is the completed case. Now, this was at 4 months, and I can tell you she's now at 2 years, and we are still at this steady state of health for this implant.